Even an ordinary day isn't so ordinary when you work in a hospital, because every day, hospitals handle emergencies. Whatever your role may be, your commitment to being prepared ensures the best possible outcomes for patients and their families. But what if disaster strikes? In your community, or another community? Is your hospital prepared? If today's ordinary day includes a natural or man-made disaster, the everyday skills of healthcare professionals will be critical. These professionals will be needed and they will want to help, but will they be able to? The Michigan Volunteer Registry is an online system that can help expedite the response process for staff augmentation and credential verification.
The reason we have this program really goes all the way back to 9/11 in the anthrax attacks, and people overwhelmingly want to help. So what happens is you get not only the medical surge emergency event, but you get a surge of individuals wanting to help out, pre-verified in the system, pre-credentialed, so they can be notified to come support an event.
To accomplish that, we created the Michigan Volunteer Registry. It has become the premier volunteer registry in the nation.
The Michigan Volunteer Registry is part of the Emergency System for Advanced Registration of Volunteer Health Professionals, a program endorsed by the Joint Commission and authorized by Congress. Launched in 2006, the system is used for verifying the identity and credentials of volunteer health professionals that could assist in an emergency. It is key that volunteers be pre-registered and pre-credentialed to effectively integrate into an emergency response.
Staff always want to respond. That's part of our healthcare nature, and they want to go to where that crisis is and be able to help patients and their families out. It's really nice to know that there's been people that have thought about this enough to volunteer on my volunteer registry so that their credentialing is already taken care of, and that we can utilize them in a moment's notice when we need to have volunteers out there.
You don't know what's going to happen. You don't know whose expertise is needed. Nowadays, everybody's going to be watching on television right away. If something like Joplin were to happen here in Michigan, we're going to want to be there and be able to respond. And this is one way where we don't have to look at CNN to find out where the doctors are needed. We can actually pull up our smartphone and know that this is who's needed now, who's needed later, and get everybody in the right place at the right time.
You want to make sure that we have the appropriate staff taking care of the patients and the families that have already been through a major crisis if they've been involved in a disaster situation. And the My Volunteer Registry helps us be able to do that.
I've got my license in my pocket, but the registry just adds that extra level of vetting so that everybody involved knows that I'm a physician who's approved to help out in a crisis.
You know, it makes me feel confident, and particularly because even though I am a registered nurse, you know, I have a certain skill set that I'm an expert at, and some things that in the field of nursing I haven't practiced for many years. But with the registry, when you log on, you can actually pick and choose what you feel confident in terms of nursing skills that you would be prepared to provide. And so I know that if I am deployed to a disaster site, that my skill set would be best utilized.
The benefits of hospital participation is twofold. It keeps us in compliance with Joint Commission, which are their standards which require us to have a plan in place for emergencies, whether it's, again, natural or man-made. And it also gives us a plan of action, how we ourselves as employees there can support other hospitals around the state, nation, or wherever in times of emergency.
It's important that our skills are top-notch, expert level, cutting edge, and it's important that we have a key group of people that know exactly how to respond in an emergency situation. So having that training right here in this community is incredibly beneficial to this community. We know this community, we know our way around, we know the people here, we know one another. We're the best resources to take care of our people.
It's a simple process of filling out paperwork online and giving them access to your credentialing information so that you're ready to go if there's an emergency. Well, it's not really any more complicated than signing up for Facebook or Kindle or anything.
For us to step in and become active was very easy for me to register myself as a participant in the program, and very easy for me to monitor and administer the volunteers that register as well. It is hard to find the time, and I myself have a very hard time trying to find time for extra duties or extra responsibilities.
And the heavy lifting is really done a lot at the state for that credentialing. The hospitals don't have to do it themselves.
I think there's a sense of pride in being involved in this program by the hospital because it keeps us prepared, it keeps us on top of our game.
We had an incident in southeastern Michigan in the fall of 2012. It was the Meningitis Outbreak, and at first St. Joseph Mercy Hospital indicated they would need nurses. So within 24 hours, we had a list of 90 nurses with background checks we verified, credentials we verified, ready to go at their ready if they needed those nurses.
All this can happen within minutes. So the Michigan Volunteer Registry administrators are able to query volunteers and find out exactly the type of event they're willing to deploy to, their credentials, their interests, their location, where they live, where they work, what kind of skills, specialties, certifications, languages they have. So rather than using just a database and skimming through thousands of data, we're able to narrow down the exact criteria that are needed according to the hospital specifications.
Use of the Michigan Volunteer Registry makes it seamless to work with the hospitals, the region, the regional healthcare coalitions, emergency management, and the state to facilitate and request identification of volunteers.
It's not a matter of if a disaster will happen, it's going to be when.
Every day, hospitals are faced with emergencies. Whatever the day brings, they must be ready. The ability to access the Michigan Volunteer Registry's pre-credentialed staff to provide additional support could be life-saving when disaster strikes.
I'm ready.
I'm ready.
I'm ready.
We're ready.
Please join Michigan's Emergency Credentialing Initiative to create a stronger disaster response system. Go to www.myvolunteerregistry.org to register as a volunteer or request information on how to participate.
Our healthcare system is ready. Is yours?